Tanya Smith. I'm an UMSL student, and today I just want to talk to you about a public issue that I find near and dear to my heart. It's called mental illness, also known as mental disorders, the opposite of what we call having good mental health. So I decided, what better way to figure out how it affects people than to actually go out to the people and ask them just a few questions regarding mental illness and just see how it affects them as individuals and what they see through their everyday lives. So, what I'm going to do is take you through a couple different interviews just to let you know how exactly mental illness affects everyone around you. Hope you enjoy it.
Well, first of all, they don't treat people right. Most people that's sick don't get treated right. We know that. Not only from the people, their relatives, and the nurses, and a lot of the nurses treat them wrong, and especially if they go in the home. I worked at a nursing home, and I worked on the floor with other sick people, and a lot of them treat them so bad. It was so terrible. You wouldn't believe some people would treat their own people the way they do. But other than that, being a nurse, I worked on the floor, and I had some good doctors and good nurses that I worked with.
Do you think race also plays a big part when it comes to mental health? Do you think, as far as like black people and white people and all different type of ethnic groups?
Well, if you have some real good nurses, the color doesn't matter. Because I've seen them get rid of some nurses that made remarks about, do your skin change different colors, or do your color wash off and all that stuff, you know. But other than that, I've seen them, most of all the people that I've come in contact with are good. And I know my patients got treated good. Because, see, I would hate to have my folks get mistreated, because I know I've seen a lot of get mistreated, you know.
Okay, and then last question, just from just the public's point of view, do you think that the public has a negative or positive effect as far as people trying to seek help that do have mental problems?
Well, no, but I think it's 50-50. I see just as many white with mental problems as I have with the black with mental problems. And when you get a certain age, you eventually get the mental problems, you know. And I don't know. I think it's your age that has more to do with it than anything.
Well, thank you. So, I asked myself, why is mental health important and what's the big issue about it? Well, mental health is very important because on the other side of mental health is mental illness. And the reason why it's a public issue is because there's this big stigma associated with having mental health problems. Okay, Mr. Aaron, whenever you're ready, you can tell us about your school.
Oh, okay.
And you just
What it's all about, I did come and pick me up at 7 o'clock in the morning, except Monday, Wednesday, Friday, Tuesday, I had 2 days off. But when I'm over there, they take you on trips and play games like bowling and they very spiritual. Everybody there is really, really leading down the whole lot. And I came from one school to another one, but this one was better. And all we do, we can't smoke number twice a day. But especially with alcohol is good, they don't go for it. They check my record. My record was clean all the way. And I enjoy it. It's what I want. And I go to church, I tell my pastor to wake me up on Sunday morning. And he be there every time, on time. Across the street from me. And he comes over and we eat and look at TV and just everything that we supposed what God tells us.
Can you tell me what kind of people go to that same school that you go to?
Most of them got a mental problem. Like you gotta watch them. People that work there gotta watch them because they start fighting or something. Well, that was the other city. This new city, ain't nothing there. They'll go for it. They say they put you out just like that. But it wouldn't affect me. Both of my records because I'm Catholic.
And can you tell me is there any criteria that you have to go to the center that you go to?
I think they even take Walker is like if they got social worker or somebody else to take care of they check and stuff. When they can get it easy, they ain't got no check up. But I've been on the check for a long time because I got asthma. It don't bother me just sometimes, but it don't hurt my heart. Lord, I always tell me something good.
Yeah.
I'm just overwhelmed by it. Lord got y'all put down. And it wasn't no problem. It wasn't nobody saying, whoa, what you want? I'm not like that. I'm like, hey, yeah, I can handle that, but it's really nice.
And I got one more question for you. Can you compare the people's views of the ones that work with mental health people versus the one who don't on a daily basis? Do you see a difference in people?
A lot of difference. I just said I went to, I had a therapy, and I had to pay her to go to school, but at the campus school, I ain't got to pay them now. They go to pay me. My sister, she go, I got a twin sister, her name's Sherry.
What's her name?
Sherry. Her name's Sherry.
Yeah.
That's just like I have.
Okay.
And I have a lot of fun like that because people call me all kind of names. We're going to give you a nickname. Your nickname is Amo. Your nickname is Jethro. Your nickname is Elvin. I said, no, my nickname is the African name. And they looked at me, they said, they just bust out laughing. I told them I was from Africa. Well, that's the story.
Yeah, no, that's all right. Well, thank you, Mr.
Maybe I'll
Aaron.
see y'all again.
Yeah, I appreciate that. Well, our grandma's over there, so we'll definitely come by and say hi to you.
All right.
Well, thank you.
All right. Thank you.
So, the problem is, a lot of people are walking around that have mental health problems, but they won't tell anybody. Why? Because they're embarrassed, they're afraid. You know, they don't know how people are going to react or if people are changed. And then, unfortunately, you have a lot of these individuals walking around that have these mental health problems, and it's not being dealt with. And then, like normal everyday life that we have can affect them in such a dramatic way that it can affect us all.
Do you think people with mental health problems are more likely or less likely to seek help?
Read that again.
Do you think people with mental health problems are more likely or less likely to seek help?
Less likely.
Why?
Because they think there's nothing wrong with it.
Do you think there's a lot of individuals that believe that there's nothing wrong with them when there really is something wrong?
Absolutely.
Do you think race and religion play a big part in whether people choose to receive medical help or not?
Not really. No.
Okay. Well, thank you.
Tanya, what does mental health mean to you?
Mental health means a lot of different things to me. You know, mental health is like being healthy and educated and knowing what's going on. And then, of course, on the flip side, mental health is being depressed or being scared and, you know, unable to say what's on your mind or be too afraid, or, you know, when you know something's wrong and you just don't know who to talk to, or you try to hide it. like it's a bad thing, and you don't realize a lot of people out there actually have lots of mental health problems. Only time mental health ever comes up in the news is if there's an accident or somebody got shot. You got the lady so many years ago that drowned her kids. She got out the car and she let the car go in the water. You also got the one lady that decided to, it was 3 little boys, or 2 boys, something like that, and decided to drown them, like at the bottom of right where the water starts. I mean, you have some individuals where, you know, they will shoot their whole family up and then turn around and kill themselves. And that's the only time mental health issues actually come to the public to make them aware. But then as soon as something else, you know, the next hot topic or whatever comes up, it disappears and nobody ever talks about it. You know, we got a lot of issues with mental health, unfortunately, that nobody's even talking about it. And I think that's like a big issue. People already know about it, but they won't talk about it, and I don't understand why. And I think it's time for people to actually start facing the fact, yes, there are a lot of people out there with mental health problems. And, you know, we've come so far in all our technology, and still, you have like psych floors in hospital. They might have some outpatient education, but the most outpatient education I've ever seen is when they get to leave and they say, okay, well, you got to do outpatient. You got to come talk to a group of people for so many meetings, and then after that, like, it's done. You know, I've met patients where they get upset or they have an argument with somebody, and their only response to that is to try to hurt themselves. You know, people don't know how to manage their anger, and they don't have any good coping skills, and these are simple things, and this is nothing new. People already know about it. So that's my take on mental health.
It was kind of hard because I had to do everything for Terry. She used to have seizures every month. I had to take her to the hospital, and they treated her. Then I bring her back home, and then about a month or so later, she had more seizures. So I was in and out of the hospital with Terry for a long, long time. And then she got older, and she was still having, but not as regular and everything. So she was my baby. I love her.
Yeah.
And she passed away, and it broke my heart.
Do you think it was hard getting help, having a child that had mental problems? Or was the doors open to you? Was a lot of people trying to help you as far as, you know, in the system?
Yeah, they helped me with it.
Okay.
And everything. So, and she would get sick. Have those seizures.
Gotcha.
And she would, you know, and then she would be fine. And then the next thing, you know, if you have no seizures and everything. And so later on, she outgrew them. And she didn't have, you know, she didn't have them anymore.
Okay.
And all in all, she was a sweet baby. She never did holler and cry, nothing like that. And when she got a certain age, you know, she began to, you know, try to talk, you know, just normal jump. And she was a happy little girl. I remember one time Jessica fell on Terry. I mean, not fell on her, but fell by her. And she heard the sound and she just laughed. Yeah, she was a sweet little girl. But she never did walk or talk or do anything like that. But I love my baby. And I hate that she passed away.
Yeah.
And everything. So,
Okay.
all in all, it wasn't good.
Okay. Well, thank you. Well, I think as far as mental health goes, I believe that the public at large thinks that if you don't talk about it, then it's not there. It's like I don't know, like a little white lie or something. It seems like I deal with a lot of people in the hospital that have mental problems, and a lot of them don't even have the necessary resources to try to do better. And a lot of them have actually confided in me to say that when they do actually feel like they can, tell somebody that they do have a problem, a lot of people kind of almost look at them like, I can't believe you just told me that. I just feel like a lot of people don't even want to talk about it, and I think, mental health is very important because it's a lot of individuals that do have mental health problems that are too afraid or don't know who to talk to about it. And I just think that as we go on, that nothing positive is going to come. Just like the gentleman that, woke up in the middle of the night and shot 16 civilians. They said that, he had mental problems, but nobody had talked about it. And I just think the word needs to get out there so that we can do better. Like when you hear people just talk about mental health, first of all, do people even talk about mental health like when you're at work?
Not really.
Okay.
But if I had to define mental health, I would say, I guess the state of being happy.
Okay.
I mean, no matter what you're doing, I guess if you poor, as long as you, I guess, able to make it. Mental health would be being able to survive, being able to make ends meet, not living on the street. Just happy.
Okay.
I mean, you don't have to have a lot of money to. No, that's what I would say. Mental health is being happy.
Okay.
Satisfied.
And the opposite, so that was the positive side. What's the opposite side of mental health when it comes to like depression and all that good stuff? How do you think the public views people that have mental health problems?
I would have to say, I don't know, because people are afraid of the unknown. So I would say, if they really haven't experienced it themselves, or been around a person that displays mental health, they probably look down on them.
Do you think they are afraid of them ever?
Yeah. Oh yeah. Afraid of them going off, losing it. Like postal. Oh yeah, definitely.
So what do you, like you just named one, but what would you say would be a short-term or long-term consequence of a person having a mental health problem and it not being, like they're not going to the doctor and not telling
Not
anybody
being
about it? Mm-hmm. So what about the short-term one?
The short-term one would be, I would say, a dramatic reaction. Hurting someone, snapping, without even realizing it.
In the long term?
Build up reaction. And one more thing, they would explode and take it out on people that really have did anything to them, but they exploded, they just boiling over. So I would say whoever getting their way, they just take them out. And that's not even their target.
And can you recall any examples that you heard as far as negativity dealing with mental health on the news? Like you said, people boiling over.
Well, not recently, but when I was growing up, we stayed right next door to this couple, this family, and her boyfriend, I guess she had broke up with him. They had a child together, and what he did was, he was in jail. He had got out of jail, and he really couldn't accept the fact that they weren't together anymore. So what he did was he killed her. He killed her sister, who was pregnant at the time, like 7 months. Tried to kill their little brother, but he got away and tried to kill the mother. So, oh yeah, and that's a true story. That's a true story.
Can you think of anything that we can do as a society as far as preventions with mental health?
I would say one thing that we can really do is insurance. Lower the cost of insurance. Make sure everyone that has a family or that has medical care get the insurance to see a doctor that they need. Be able to make it affordable. Regardless, if they can't afford it, they need to go to the doctor. They should be able to go there and deal with the bill later.
Okay, and so do you think As far as screening, do you think physicians do a good job of screening people for mental health problems?
I would say no. Because you go to the doctor, if you don't bring it up, if it's not obvious, doctors are okay, but my thing about doctors are, doctors are all about the money. I mean, something can be wrong with you, and sometimes you can't explain what's wrong with you, or you can't express what's wrong with you. If they don't see the immediate, like if you cut, you're bleeding or something, they really don't pay attention. But they can know that something is wrong. You're depressed, you're crying. Yeah. But if you don't bring it up, it's like, okay, well, you can check out at the corner. I mean, well, not the corner, but the desk or whatever.
And as far as once a person has a mental health problem, do you think the doctors or physicians, or if there's facilities that can help those people after the fact?
Huh?
So if you got somebody that has a problem,
Mm-hmm.
so let's say that they already have a mental health problem,
Mm-hmm.
the doctor's aware,
Mm-hmm.
they give medications. How do you think we can help these people try to live a normal life?
By making sure that if they need help, get the professional help that they need. Follow up visits, stuff like that. Being proactive.
Okay. Is there anything else that you'd like to say regarding mental health, as far as from a personal standpoint or anything?
I would say mental health is a big concern in St. Louis, Missouri. I mean, so many homeless people, so many people been on jobs for 30, 40 years, depressed, losing their jobs, being outsourced. I would say it's alive in St. Louis.
So you think it's a big issue?
It's a very big issue, but it's not brought to light.
Thank you. Okay, let's touch base on a policy. A particular policy that I would like to talk about is dealing with the military. As far as the military, we want to think about pre-assessment. Before we even allow these individuals to go out and to protect us, we need to have a pre-assessment to make sure that their mental health is okay. We need things like, have you ever had thoughts of suicide? Have you ever had thoughts of hurting others? Have you ever had a traumatic experience that has affected you in the past that still every now and then comes around? Also, we want to talk about the individuals in between deployments. You have a lot of soldiers that have multiple deployments. Studies show that the more you actually get deployed to Afghanistan or wherever they send you, and you deal with a lot of horrific events, you are more likely to suffer from post-traumatic stress syndrome. You are more likely to suffer from PS. You're more likely to suffer from post-traumatic stress syndrome. When these individuals come back from seeing their buddies being shot, exploded, dismembered, they carry a lot of weight on their shoulders. And then all of a sudden they're supposed to come back and just go back into normal society like nothing has ever happened. I was told that when they first come back, it's 2 weeks where they actually have what's called like a downtime so that they can get reorientated with normal society and civilians. Also, as far as with the families, they too need to actually have someone talk to them as far as like a therapist, just to get them ready so that they know that the person coming back is not necessarily the same person that left. The next thing that I would like to talk about is prevention. And this would affect both the military and all the civilians. We need to make sure that our primary care physicians actually do a pre-assessment and ask them certain questions, just like we have to do in a hospital. Whenever you first meet someone, we have to ask them certain questions as far as suicide, make sure that everything's okay. Secondary, what we would like to do is screening. If you're not aware that someone does have a mental illness, if you start screening, you are more likely to get people that do have mental illnesses and to direct them to the right facility. If we screen and know exactly what we're looking for and ask the correct questions, we are more likely to help more individuals than we are just assuming that they will come in and speak with us. As far as tertiary, the ones that we already know that have a mental health illness, what we want to do is make sure that they stay up on all their follow-up visits, make sure that they have the appropriate documentation, make sure that they have hotline numbers that they can talk to, make sure that they're aware of all the group facilities that they can go, because it's not just them. Sometimes people have a feeling of feeling alone. and we want to make sure that everyone's okay. Oh wait, I got one more. And as far as education, I believe that the public needs to be educated that it is okay to have a mental disorder, and it is not just them. A lot of people still associate, like Malcolm Blitz, you have the Bell Fountain facilities, you have all these different facilities where they will actually just take the people and lock them away. But it's not like that anymore. You have everyday people going on with life, being able to deal with their mental health issues. But if we as a society do not help these individuals and encourage them to get help, we will see more issues like we do on the news. We will see soldiers shooting people for no reason. We will see husbands killing wives because they decide to have a divorce. We will see multiple co-workers being upset because maybe they didn't get that raise and decide to shoot people. It's a lot of bad things out there, but if we can just help prevent a couple of them, we are doing our job. Thank you. Mental health, as defined by the Surgeon General's report on mental health, refers to the successful performance of mental function resulting in productive activities, fulfilling relationships with other people, and the ability to adapt to change and cope with adversity. On the other end of the continuum is mental illness, a term that refers to all mental disorders. Excuse me. Mental illness. Who does it affect? It affects everyone. What does it look like? It looks like you and me. Why is it important, and why is it a public health issue? What does mental health mean to them? How has mental health affected them? And do you think society, how do you think society deals with mental health?
I don't think they do very well. Society don't do very well with...
Oh, wait. Would you mind if we record you when you answer?
Hold on just a minute. I'm finished this over here. See, my daughter, she got short-term memory. I don't know exactly what's causing it. I know she had a cyst on the pituitary gland, but I don't think that's it because the cyst is strength. And so I don't know, but she got short-term memory. So mental health is an issue with a lot of people, not necessarily because of tumors and what have you. It can be from a number of things. It can be from something that happened to you during your childhood, something very exciting or something real scary or something drastic happened to you, and it can cause you to have all sorts of bad memories. And then a lot of things happen because now, in ages now, you got a lot of young women having babies, they're doing drugs. And that takes effect, depends on what kind of drugs they're on. And it can affect the babies, But people with mental health, they're not treated very well. I can say that in public, because it's the truth. And now they're trying to close up all the places where people with mental health go. And a lot of people need help, but they can't get it. That's why I got a lot of them walking up and down the street. And it's sort of sad. Hi, baby, how are you? These people in these positions, they spend a lot of money on stuff that they shouldn't spend it on when they could be spending it on trying to help the poor, because the rich don't care about the poor. Never have and never will, but that's what God said. But anyway, the money they spending on when they go out to these different meetings on prostitutes and all these dinners and stuff, they could be spending that money trying to help the poor, not only the mental, but you got a lot of poor people need help, So, it's a shame. It's not as bad as it is overseas, foreign countries, but it's bad here in America, and it shouldn't be, because America, they rich. The rich is getting richer and the poor is getting poor, because the rich they think we don't deserve anything, because we're poor. Not only black, but we got Mexicans and a lot of other nationalities that they think we don't deserve anything. But like I say, it's not a good thing. You have it, like I said, she got short-term memory. Sometimes, she can ask me something now, I can tell her something now, and 5 minutes later she's asking me the same thing over again. You understand? Since you've been through it, granddaughter, paranoid schizophrenic. My mother died, my oldest daughter, she died last year in January. But, like I said, trying to get help for her, you have to go through all sorts of changes to get some help when it shouldn't be, you know. Like I said, it's an issue.
Right.
It's an issue. And like I said, until it happened in some of their families, they can see where they can see the effects of it, what it have on you, what you got to do to deal with it. You know, trying to deal with people with mental issues, and you don't ever know if they say what bag they're coming out of. You know, they don't want to give them medication, and sometimes they over-medicate them. You know, and they have them like zombies. You go to Malcolm Bliss, some of them sitting up there, they don't know they're even in the world. But they have to do that to try to control them, you know, which is not fair, but life is not fair, you know. Yeah, so.
That was awesome. Thank you.
Worked at a nursing home, like I said, it's sometimes they're on the staff, and sometimes they're not doing what they're supposed to do. The CNAs, the nurses, and what have you, they're not doing what they're supposed to do. And a lot of people in there, they suffer.
Yeah.
You know, and some of them, they don't know how to treat the residents. You know, like I said, they're there, they don't want to be there, but they're there for a reason. Because they don't have any place else to go. The family can't see to them, so they have to put them in a home. That don't mean they should be abused, you know. I mean, to me, I would want to treat them like I would want to be treated, or some of my relatives to be treated. See, when Lisa was in the nursing home, I was there every day. And like they didn't never know when I was coming. Sometimes I went at night, so they didn't never know when I was coming. You know, so she got pretty good care. You know, but I said, like, I mean, a lot of people, if the relatives don't come to see them often, then hey, they don't get as much attention as they should.
Yeah.
You know, so, but if they know the relatives are going to come and check on them often, then they get a little better care. But the ones that the relatives don't, I guess they said, well, if the relatives don't care, but that's beside the point. This is your job.
Right.
You took the job to help these people. And when you don't do that, you fail in the system, you know. Like I said, these are human beings. They shouldn't be treated like animals. You know what I'm saying?
Yeah.
If I can't feed myself, then they sit my food in front of me. And it's cold before somebody comes inside to feed me. So hey, it's not the best tasting food in the world anyway. You know, but then I gotta eat it if I'm hungry. You understand what I'm saying? A lot of stuff goes on that shouldn't be going on. Not only in the nursing home, in the hospitals, in rehab centers. You know, it's not fair, but like, what can you say? People don't take their job serious. When I was working at the nursing home, I look at those people, that could be me. You know, that could be my mother. But thank God I was able to keep my mother. You know, but like I said, it's a shame. What can you say? You know.
It is a shame.
I mean, I get better, boss get better care than some of those people in the nursing homes do. You know.
Can you tell them who boss is?
That's my baby. My big baby.
Your dog.
My spoiled brat. He's my dog. Yep, that's my baby. Yep. No, I mean, it's a lot of reason for people being out here mental. They're afraid of these mental people, you know, which you should be, because like I said with my granddaughter, she's paranoid schizophrenic and she be listening to those voices. And you never know which voice she's listening to, you know. I can tell by the expression of her face. And then when she started laughing, I know she's talking to one of those happy voices. But then when she started going all out there with profanity and stuff, I know this is a different voice. So, hey, I just give it a hand, you know. But I learned how to deal with it because I had to pray a lot.
Yeah.
Pray. I'm the only one that she would let help her since her mama died. But I thank God that He give me how to deal with it. You know,
Yeah.
it's not easy. Because like I said, you go out there, she might cuss you out, she might not let you in. You know, so I didn't, you know, I just kept praying and saying, Lord, bless now. She lets me in, and she fixed me Thanksgiving dinner. She fixed me Christmas dinner. She fixed me Easter dinner. So God is blessing her, you know. But like I said, you have to know how to deal with those people. You know, like a lot of these homeless people who walking up down the street. You have to know how to deal with them, you know.
Yeah.
And you think about this is a human being, not an animal, not somebody. They can't help it because they're like they are. I'm sure if they change things, they wouldn't.
Hopefully they will, you know, they were talking about closing those places. Hopefully they might try to open up some more.
They should open it more and put more qualified people in there. A lot of them qualified, but they, like I said, first thing they said, well, they're not paying me enough. That's beside the point. You knew what the job was paying before you took the job, okay? So you do what you're paid to do. It's not going to hurt you to go an extra mile, do a few little extra things that you're not paid to do. So what? It's not going to take anything from you.
Right.
You know, but like I said, if the system is all screwed up in it, the whole system is all screwed up. The people up there in Washington, D.C. on down, they're all screwed up. And everybody talking about the Republicans this. I said, look, first of all, the Republicans, they got positions. They don't have power. God got the power. And He's in control, whether they think it or not. And they're not going to be able to do no more than He allowed them to do. Because like I said, He regulates their mind. And their heart is in His hand. The Bible says He can turn their heart like they do a ship or the wind. You know, they can go decide to be here for one reason, and they'll be signing in it. Oh, I didn't mean to do that. It's too late. You know, that wasn't what God intended for you to do, you know. But these white people, they think they superior to everybody, and they got the whole world in their hand, but not so. That there's going to come a reckoning day with them. Because all that stuff they doing, they don't want to help the poor. Now they trying to blame Obama. And like I said, the 4 years he been in there, he trying to clean up the mess that Bush left when he was in there. Okay, by the time he get that done, his 4 years are up. Now they saying they don't know whether they didn't think he was gonna get elected the first time.
Right.
You know, so it's not in their hand. You know, because whatever his name is, this man is doing all this flapping his lips. He think he got it sold up, but he don't know how it's gonna come out until they go to the polls.
That's right.
You know, because a lot of people that he think are gonna vote for him, by the time election time comes, they might be done change their mind. You know, because he's saying a lot of silly stuff, and if people listen to what he say, when he started listening, I said, okay, dissect what you're saying, sir. You know, you listen to what he said. He said, his other folks said he's talking out the corner of his mouth. You know. People need to pay attention to it. You know. But the system is screwed up. Like I told the police, with one of my little great grandbabies when they called, I told them, look, that's why y'all got to be at so many correctional facilities now. You all have taken the job away from the parents, what God gave to do. The parents, the Bible said, parents, train up your child in the way they should go, not the system. I don't go for putting them in the hospital. You don't have to do all that, chastise them. But you got to let them know, hey, if you're going to stay here, I got rules in here. They got rules out there in the streets. They got rules in the...
So, let's summarize what we've learned. What's our big issue? Mental illness. What does it look like? It looks like me. It looks like you, your neighbor, your mom. It looks like anybody. Who can it affect? Everybody, anybody, somebody, even me. Why is it important? It's important because not enough people talk about it, and we all have a problem with it. And if we do not speak about it, that doesn't mean that it goes away. That just means that unfortunately more people will get hurt in the long run. Short-term consequences of not taking care of this issue. Simple things. Your boss cursing you out. Somebody's cutting you off on the highway. Somebody's following you because you cut them off on the highway. Long-term consequences. The man next door killing his wife because she wants to leave him. Somebody going to some random store and shooting everybody up because they got the wrong size. Somebody just doing really crazy stuff for no reason. Somebody going into a school and hurting the kids. How can we prevent this? Well, we need to start screening individuals, letting them know that it is okay. We need to know what to look out for. We need to let our physicians know that it is okay. Please bring it up, because if you don't bring it up, no one will. How do we protect the people that already have a problem? Well, we need to make sure that they follow up on all their appointments. We need to be there to encourage them. We need to let them know that, hey, there is a support group down the street that you can feel more than free to talk to. Or we can give them some numbers to some hotlines and let them know it's okay. As far as educating, we need to educate anyone who will listen. Everybody and anybody. Your neighbors, your teacher, gosh, the guy down the street that bags your groceries. Anybody can help. And as far as future things, what we can do, well, really there's only one main thing to do. Continue to educate the population so that they know, hey, it's okay. And together, I think we'll be all right.
You smile like that's not.
I am LaTanya Smith, and I approve this message.